As cases of COVID-19 rise across the country, there are growing concerns about whether hospitals are ready to handle a second wave. The head of the University Health Network is expressing concerns about an alarming rise in hospitalizations related to COVID-19, similar to what was happening in the early days of the pandemic. Kevin Smith is the CEO and president at University Health Network. He joins me now from Toronto. Kevin, good to see you.
Good to see you as well.
Been a while. All right. So the number of COVID-19 patients in the hospital network going up. At last check, I believe it was 7. That may not sound a lot, but it's concerning. Tell us why.
Yeah, it was definitely concerning, as we noted it, since we'd had many weeks or a number of weeks of no patients, 0 patients in hospital, which was fantastic. And our numbers in terms of positive tests were going down, as you recall, under 100 a day. And not unlike in wave 1, we saw this 1 and then 2 and then 5 and then 7. And the first round of this wave 1, we basically saw numbers increasing or doubling every 7 to 9 days. And if we were starting that trend, I felt it was very important to show that out now so we could get back to being very attentive to how to prevent this illness from being transmitted.
Okay. And what does that look like, being very attentive?
Yeah, so it's a pretty simple formula, as you know. It really is continuing the good public health measures of frequent hand washing, wearing a mask safely and appropriately, which means covering your nose and mouth, not going to large social gatherings. And as we know, the most recent outbreaks or those with significant cases have mostly been associated with that. And avoiding in indoor environments like bars and restaurants where people might be less cautious. And really, truly following the very simple public health measures, including physical distancing.
So why does this current situation with the hospitals remind you of the early days back in March?
Mostly because the numbers, both testing and in-hospital patients, were going up about the same rate at that time. And unfortunately, the nature of this illness is it goes from a rather modest number to a doubling every week or so. And as that occurs, we worry that our hospital capacity will be stretched and that we could run into an environment where we'd have to start canceling other procedures, which we had to in wave 1. There were over 100,000 procedures in Ontario postponed, and obviously that was less than desirable for those patients and providers. So in wave 1, we saw very similar trends. Just want to make sure that we don't wait too long to call that out in a potential wave 2.
Do you feel better prepared, though, this time around?
Absolutely. I think the levels of government have been working very well together during phase 1 and the beginnings of this potential phase. I also think that we know much more about the virus than we knew then. We're better prepared from our critical care perspective in terms of sizing and staffing. We obviously are a little anxious as schools have restarted and more businesses have restarted, and people run the risk of not following those public health measures as carefully. But unquestionably, we're in a better position than we were in wave 1.
Dr. Kevin Smith, CEO and president of University Health Network, thank you so much for your time with us this morning.